is a rarely discussion in my clinic. When I hire a new employee, part of what I go over is expectations, and not just for productivity, but for timeliness of documentation, attendance to meetings, all those the tasks that it takes to be a therapist. Productivity is certainly one of those. My expectation is this is the number we're shooting for. If you're not that at the end of the week, I want to know why. I never want to be surprised at the end of the week. I run a weekly report that I send to my boss, and I want to be able to explain that if somebody is lower than their target. So I think it's really important to treat therapists as responsible professionals, and I think nagging about productivity, which is something they're already thinking so much about, and they have so much pressure to perform, I don't find it to be helpful. So as a manager, what I want to do is support those therapists who need help, whether it be with productivity, with a certain treatment modality, whatever it be. I want to help them and support them there. But on the other hand, for those who are performing well and can figure it out and have their own strategies, I want to give them the freedom to do that without continual reminders. Now, if I find out at the end of the week I'm surprised, then there's a conversation. But that usually happens one time with a reminder of, I don't want to be surprised, and then it's taken care of. And oftentimes I find therapists are coming to me at times when it's not even necessary, because while they might have been low in a day, by the end of the week they're fine. And sometimes it's helpful for me to run a report to show them, you might have been low even this week, but for this performance reporting period, you're still above, or you're still meeting, or you're still fine, so they can see that ebb and flow that comes with being a little higher sometimes and having a bad week.
So what I'm hearing here is a disconnect, right? We have rehab directors that don't feel like productivity happens when you have outcomes and doing all the right things, but yet our therapists are saying that's a stressor, pretty high on our top 5. What ideas do you have, or what are you working on now, right? As we're all working on it. What are some things that you're working on, or ideas that you have, or if you had one wish, what would you do to make the goals align, all the stars come together?
One of the things that I do currently is I meet with each therapist once a week, briefly, any given day, report for the prior week. And we look and see where they are, what their challenges are, and we discuss, when I go to them and I say, how has your productivity been over the last week? They should have a good idea of where it is. So sometimes I feel like I put that high on their list, even though it's not the highest on mine. They do have to maintain that awareness. So I don't know that the two will ever exactly align, but they do need to have that working knowledge of it every day, because if they have a bad day, they know the next day or so they've got to really try to improve to make it kind of even out. But I just sit and listen and let them tell me what's working, what's not working, try to problem solve. You mentioned, not having breakfast done on time. That's always an issue every rehab job I've ever had. So just going and trying to get that more organized for them, so the rehab patients are getting done with breakfast first. Something that small, one conversation can make a big difference in that therapist's day. So I listen a lot.
And I agree that disconnect will likely always exist to some degree, because as a rehab director, if you have a strong team, they know what the expectations of the job are. Productivity is an expectation of the job, and so that's something that they work very, very hard to hit or exceed. So if I have a strong team, and I have a team that's responsible and they're internally motivated, which is what I'm looking for in a team member, I know as a rehab director they're going to do their thing to get it done. And so that's why I think it's not high on my list personally. It may be for a particular therapist at any given time, perhaps a new therapist, somebody who struggles with it, and at that time it'll be higher on my list of concerns. But day to day, I think therapists who are internally motivated, they're very type A, very driven, rule followers, that kind of thing, it's always going to be high in their mind. I think as rehab directors, we need to communicate that, what the expectation is, what the understanding is when those numbers aren't hitting where they're expected to be. And we also just need to be so committed to always looking at what are we doing to help them, and are we really remembering what is it like to be a treating therapist, and look at their day, understand it, and do what we can to help. And I think that doesn't take the focus off of productivity, but I think it makes it makes it easier.
I might try not to use the word productivity, and I might try to talk, say, hey, did you have a rough day yesterday? How'd your day go? If I know that they were lower in productivity. And I might just have a conversation with them about that. So if they say, well, I had this person refuse, then this happened, then we might talk through it and say, well, did you try this, or what things did you try, and just kind of make it more of a conversation. So that way, kind of using it as an education moment too.